bones. There are basically three types of joints in the body based on motion. First are the immovable joint arthrosis. These are the joints present between the first sternum and ribs, and so the articulation between the mandible teeth. They so-called joint. The second slight movable joint, the arthrosis, called a full movable joint, diarthrosis. Definition of pain. One of the signs of disease or injury that brings an individual to the hospital consultation to a practitioner is pain. Nobody wants pain. Yes, yes. Defined by International Institute for the Study of Pain as an unpleasant sensory and an emotional experience associated with, or the assembly that associated with actual or potential tissue damage. This definition indicates that pain may result from an actual injury to tissue or the perceived threat injury to tissues. Actual tissue damage or perceived threat of injury as occurred serene. Because of actual or potential tissue damage, the symptom has a definite time onset with clear pathology, serve as protective mechanism to the injury or complication of injury and allow time for the injury to heal. Chronic pain, on the other hand, is not protective and does not serve biological purpose. And to feel pain is an essential component of the body's ability to heal. It's the body's way of telling us there's an injury and we will do something about it to ensure that healing occurs. An important consideration when talking about pain is the fact that one patient pain is not the same as another patient pain, even if they experience similar injuries. Perception indeed is a subjective experience influenced by a complex interaction of biological, psychological, and social factors. Pain at the joint is a discomfort that one perceives specific joint, which may be caused by repetitive injury, trauma, arthritis, musculoskeletal, MSK, joint pain. MSK system diseases, condition that affect the system and that impairment in the muscle, bones, joint, and connective tissues, leading to a temporary limitation in functioning and participation. MSK conditions are typically characterized by pain, persistent, limitation in mobility and dexterity, reducing people's ability to work in activities. In MSK structure is the most common form of non-cancer. MSK conditions are relevant across long childhood to age. Those conditions that are suddenly and shortly to long conditions such as chronic primary arthritis. Muscle conditions include those that affect joint, bone, muscle, multiple body areas, system. These conditions are the contributors to the great need for rehabilitation. They are among the biggest contributors to the needs of rehabilitation services among children. Say condition often exist with diseases and increase the risk of developing diseases such as cardiovascular disease with healthcare condition. So it's developing issues. Joint pain. So global body of disease 2019 data show that estimated 1.7 billion people globally healthcare condition, including low back, arthritis, and arthritis. The various of condition varies by age, diagnosis, just is in the Western Pacific region, Southeast Asia region. So, arthritis, arthritis, gout, and other MSK conditions. Say condition increase with age. So, such as juvenile arthritis, children development, It's a major reason for exit is the society. Surveillance to show that the number of increase in the future is of basically Nigeria. Nigeria. Several studies have been conducted by various disorders. I in 2022 reported among declares 12 months, 7 days of disorders were 87.3 and 63.4% respectively. Sugar and lead were the two most affected in the side based on 12-month surveillance studies. With regard to school teachers, Ojoawo and 28% among secondary school teachers, the sugar joint being the surveillance by the neck. In the study conducted among adolescents, Ojoawo in 2018 reported a prevalence of 46% way back. In the last 1 year, there was a association between present playback and each of family history of playback, occupation, and education, mothers occupation, education. The study showed that prevalence of pain at playback was high among 10 to 14 years adolescent. Some parental contribute to the occurrence of pain. Adolescent. A study conducted among Christian and Muslim faithful was established that the point prevalence of pain was small. Christians responded than that of Muslim. The last 12 months, 66.7% Christians, 70.8% Muslim reported pain. Ojoawo and Wasiu, 2020. Another study by Ojoawo, 2023, among the Nigerian University academic staff community, so documented that 83.4% reported 12 months, 61% the last 7 days. The body part was affected was neck. Now, the study, the search work also confirmed that 71.7% academic and 63% of non-academic experience was years. More than 41% of respondents reported pain the last at the neck. Percent way back to 20.6% at both knees in the last 12 months, Ojoawo 2016. Among administrators, 54.6 escape pain, and what was the sitting as the major cause of pain, Ojoawo and Awoniyi 2012. With this empirical document, we can establish that there was a cause of MSK pain among different professionals in our environment. Indeed, stages of members of them seated in this hall now of MSK pain or another. So 2 talk was affected within the last 12 months, years and years. MSK disorders are system pain, typical limitation in mobility, dexterity, function, resulting restriction, especially in social roles, associated impact on communities. Consequently, almost impact to early determined workforce activity that stop disorder. There are numerous reasons Any series of meetings. This is called not sitting. If someone cannot comfortably for an appreciable period during his work, there may be seek for which may necessitate visit sent from work. Stated by excessive use, trauma to bones, musculature, muscular structure, ligamentous and nervous system. The injury can result from body twist, local disaster, tumbling, bone crack, due to some people of state pain. They are sure that the most common is low back, neck, knee, in that order. Shoulder pain is common. Special professional like teachers. Searches were focused on the evaluation of pain from those parts of the body using physiotherapeutic modalities. Physiotherapy is concerned with identifying and maximizing the efficacy of this field of promotion, prevention, treatment, prevention, education, rehabilitation using physical means. Low back pain. Their lifetime. There are two types of pain at the back: the organic and inorganic. The organic are those that are infection, fracture, infection, fracture. They form the majority, 97% of the back pain around the world. Specific back pain. Not a diagnosis, but the symptom anesthesia, the property, disability. So, major role in the pain with some of these clinical. And 11, vertical oxidative pressure. Research went further to establish the pressure described by Urugat, 2007. The 13 was used to treat about 84 patients. In the research was observed that there was a reduction in pain intensity, disability of the patient. This was presented in 14 work of pain in Milan, 2012. Non-steroidal anti-inflammatory gel. Diclofenac, methotrexate, used to treat low activity. Public administration of onset can allow for efficient medication that may reduce systematic side effects associated with medication for the same clinical situation. Application can assist by promoting the transport of compound to the skin, a method sometimes called sonophoresis. This effect, the mass control study was conducted on here. The management of low back pain, it was tied to the patient of low back sonophoresis, the management of patient with low back pain, the mass control trial. Two groups of patients with low back are treated in the work. Then, using breath and exercises, the was in their one that actually says the local general improvement in destiny and stability as well. This is an indication that the right exercises are carried out correctly. There will be reduction in pain and stability of patient with local. We then design a study which involves a set of tools and exercises position, control, and timeline on pain destiny and personal stability of patient with specific low back pain, Ojoawo, 2017. The study witnessed two patients with low back pain in 2 of 21 kids. They were placed on the exercise in both supine and combination of both and supine position. So in prone to failure, receive exercise in prone line position. The following by the 3 exercises done according to Psalm 2013. Subject also the 2 arms by the side. You can be head and carry out the pain for 3 to 5 seconds. 2 sets of 15 repetitions were performed or are tolerated by the patient. Exercise 2 included the occupation arm and then lifted up the pain from the position to extend to simultaneously. Watching was maintained for 3 to 5 seconds and then return. 2 sets of repetitions were performed or are tolerated by the patient. And the third group of exercise. One leg of lifted up the pain to the hip and extended, knee extended, and both arms straight forward on the pain. This person was maintained for 3 to 5 seconds and then return. 2 sets of repetitions were performed or are tolerated by the patient. Subject is supine group receive exercise in supine position, followed by the 3 exercise done according to form. Alternate arm and leg lifted up the pain from neutral position with arm extended, knee and in flare. Position was maintained for 3 to 5 seconds and then return. 2 sets of repetitions were performed or tolerated. Exercise 2 knee drag to the chest from neutral position and on the knee. Seconds and then return. 2 sets of 15 repetitions were performed tolerated by the patient. The third exercise, the edge is strong. Being slightly lifted up the pain for 3 to 5 seconds. 2 sets of 15 repetitions were performed tolerated by the patient. Showed reduction in pain intensity and disability. It was from the study that stability exercise carried out supine or combination of both positions are effective in pain intensity and stability of patient low back pain. Considering the exercises, one can think that they are cumbersome, especially for patients that are suffering from pain. There be a single exercise that one can do that can be of help. Consider a T-shaped sitting procedure, Ojoawo in Yoruba language, which involves sitting with 2 legs raised to the middle range. The concept is that the procedure subjects transverse in traction, eventually strengthening them. The muscle that stabilizes the back. This was compared with breathing exercise. The management of pain. The study established that Ojoawo was more effective, relieving pain in patients with non-specific back pain. Exercise, bed dog, banquet, side incline, long line sitting up, then strong. Some exercise can help in prevent back pain. But to be free from non-specific back pain, just mentioned about those that have been researched and those suggest maybe of start tension, back pain. Have been mentioned that sitting, standing, to sit or sitting with best support of place to prevent back pain. We need to include correctly from the ground. Many people injure their musculature and ligament below back by they lift something from the ground. The correct lifting method to bend on the knee, lift the material up to the knee. It is very wrong to bend the waist. It does injure the back. The way somebody can be ó ní àjọ láti ọdọ́ àti ìtayò láti jọ bí mẹ́ta mo ṣe ní kí wọ́n wọ̀ ọ́ bóyá ṣe lè ti lọ sóko iwájú. ọ̀rẹ́ mi kàríyù ògúrú ìfọ̀nọ́rùn ìrò ni wọ́n ro ọ̀sán fún ìjì tí wọ́n bá nà mí níbi nígbà láàdí ó sì fi ogun jẹ̀bi ìgbàgbọ́ kan náà ni ìfúnfún mi ní máa fẹ̀ ààlà nǹkan tí ò jẹ́ àsùn nílẹ̀ èrò ọlọ́run tó fi ń sùn bó ṣe jì sí ní sí ìsàlẹ̀ yẹn ni fún àgbà tó fi ń jókòó wọ́n ṣe ti wẹ̀ kò tó páàlù sẹ́yìn mo kìlọ̀ fún ọlọ́sẹ̀ tó kọjá nígbà tó rí dágbò tara bàtà kan lẹ̀ ṣe é fẹ́ bò tọrọ èyí ìtọrọ ogun ìdílé kan sọ sí ìtọrọ ọ̀fà ẹ̀yìn lílò mo fẹ́ rí pé tó fi ń sùn fún yìí dáadáa tó fi ń jókòó ẹ̀kọ́dọ̀ náà bá jókòó orí ojú dáadáa náà bá sì jókòó fún ìgbà tó pẹ́ dídé tọ́nà ṣẹ̀ káàkiri sí fẹ́ gbé ẹrù lẹ̀ ṣé ní kó bẹ̀rẹ̀ lórí orúkún rẹ̀. One of the prominent exercises to keep low back pain is Mackenzie back extension exercises. Mr. Vice Chancellor, sir, I think to instruct the audience to perform this exercise. Sure that somebody will benefit from this here. Am I permitted? Thank you, sir. Yes. Feet. Stand up. Then standing, please. Put your hand on your back. Get on your waist. Get to lean slightly backward. Lean backward. Yes. Hold it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You can sit down. I am sure that if you do this in the morning, you are going to be Netflix becoming increasingly common throughout the world with a considerable impact on individuals, community, system stresses. The common set of non-traumatic of their population increasing trend for 50 years, followed by decline, which has been found it's a lecturer. The study was carried the cervical traction on pain test and stability of patients with radiculopathy. It was discovered the application of continuous cervical traction significantly reduced pain intensity with cervical radiculopathy. There was evidence that traction decreases the pressure within the cerebral disc, the structure of the spine, by stretching muscles and ligaments. It is probable that traction has an important role in the cycle of pain. The cervical disc by elevated disc. This cycle begins elevated disc. Sink and traction within the vertebral foramen, it does not produce interest of the pain. Cervical muscle, sink those muscles to contract, transverse oscillating pressure. Cervical pain is progression technique. TAP is one of muscle techniques that by Uga that was used to treat radiculopathy, especially of the cervical region. In one of the studies treat effect of transverse oscillating pressure in the cervical radiculopathy, in a control study. This exercise was applied to the two with the TOP was applied to according to Uga. It was observed that the participants in the two groups significant reduction in pain intensity and stability, though addition of transverse oscillating pressure was significant. It is on record that the patient under exercise displayed a significant reduction in pressure. The implication is that there's no equipment for exercise of the cervical region, intensity and disability, patient specific pain, energy technique, static stretching in neck pain. Sequel to this, and this study was carried out to technique stretching process in patients with mechanical neck pain study. In this case, patients with mechanical neck pain were randomly allocated into neck NSS build subject in merit protocols. NSS build are treated with access. Both twice a week for 6 weeks. Test and functional stability at baseline, third, and season of treatment were measured. There was a near reduction in intensity and disability in med NSS build. 6-week result here. Intensity was lower in SS than MI. Functional stability was lower at med than SS at 6 weeks. It was treated from study. Med stability says SS reduces intensity better than med. Says effective in minor cervical dysfunction. We progress further to try to make some success with evidence-based development to try the clinic. By 2025, a body demonstrated 7 success for instructed by an instructor. The video clip of demonstration was produced. The group that were taught to use the clip. The clip is a guide, the exercise. The exercise was practiced for 4 weeks in the clip. They were limited in the phone. When test and stability were assessed, it was established that the video-based mechanics exercise clip was effective in it is feasible. There was a link there which we can get it. Mr. Vice Chancellor, sir, I think this exercise can again people is not to do. Sir, the other day to stand up. Am I permitted? Thank you, sir. Members of the audience, kindly be on your feet. It's work me very well. Put your 2 hands in your hand. Then use your hand to push your hand back. And use your hand to push your head forward. Do. Sustain it. You can't have any this. 1, 2, 3, 4, 5, 6, 7, 8. Put your hand in front of your head. Then your hand back. And use your hand to push your hand forward. Then push your hand forward and push it again. 1, 2, 3, 4, 5, 6, 7, 8. You can sit down. You can repeat that by putting the hand on your side, press it, on the other side, press it. Very much, sir. Mr. Vice Chancellor. Right. You can do this regularly in the morning. Show you. Let them see you the way. It has been tested and confirmed. Neoarthritis. Common condition is neoarthritis. The prevalence of knee increase with age. Previous surgery on the knee, metabolic or endocrinology factors. This of motion, swelling. The abysmal feature of this one severity of pain with radiographic structural change in joint component. There's no gainsaying that the knee OA is very common among the population, even within the audience here. The study carried out at Ojoawo, very close to the new market in labor, indicated that out of every patient, 4 will osteoarthritis with evidence of knee pain and disability. The study of a rural in Nigeria reported that 1 of every 5 Nigerian adults symptom of knee OA, most intervention. At the onset of clinical practice in OHCS labor, because strength emerges in which a substantial purpose of a case load participation afflicted with knee osteoarthritis. In the area of physiotherapeutic intervention employed, short-wave diathermy was particularly prominent. Nonetheless, persistent was observed. This trend raised critical questions regarding the long efficacy and clinical justification of routine short-wave diathermy application. The recurrence of these cases and the therapeutic ambiguity they presented became a compelling impetus for initiating a rigorous inquiry into the effect of short-wave diathermy in management of knee osteoarthritis. 10 patients in bilateral knee OA were purposefully selected. One knee was put on the software diathermy and the other on exercises. It was discovered that there was a significant reduction in pain intensity when pre-treatment and post-treatment were compared. But there was no significant difference in post-treatment pain intensity when knee on short wave and those on exercise were compared. We sent a signal that though the short wave effect but exercise are equally effective in the management of knee osteoarthritis. In furtherance to that, Ojoawo conducted a study on the comparative efficacy of proprioceptive and isometric exercise on pain test and difficulty in patients with osteoarthritis. Randomized control study. 2 patients with issue of knee OA were randomly allocated to 2 groups with 3 subjects with 20 subjects. Proprioceptive exercises, 1 group exercise. The treatment, 3rd week and 6th week intensity, joint stiffness, and scar difficulties were assessed using Womack questionnaire. Both tests were found effective, but proprioceptive exercise were more effective than isometric. Mr. Vice Chancellor, sir, suggesting here and do what we call squatting exercise. This involves squatting down 3 times. If one is unable to do it, possibly because of pain, the joint, when inability is detected, may require more attention. The squat exercise is a screening tool for early detection of disorders of hip, knee, and ankle. Communicable diseases. Many non-communicable diseases are the foremost of death and disability in the world. CD refers to a group of conditions that are not mainly caused by infection, resulting in long-term health consequences and not related need for long-term treatment and care. These conditions include cancer, CBD, diabetes, CDs can be prevented by reducing common risk factors such as tobacco use, alcohol use, activity, and unhealthy eating habits. In Nigeria, the common NCD include cardiovascular disease, hypertension, diabetes, and cancer. Many studies have documented the rising prevalence of NCD among the general population in Nigeria. Hypertension is said to affect 25 to 48% of the adult population. The contribution of obesity to the incidence of cardiovascular risk factor, including dyslipidemia, type 2 diabetes, hypertension, and deep sleep disorder, is reported in literature. It also leads to the development of cardiovascular disease, and cardiovascular disease mortally dependent on cardiovascular disease factor. Research data on obesity is determined by waist circumference and the cardiovascular disease risk maker that is independent of mass index. They are assessing body obesity. More complex methods include bioelectric impedance, dual energy, X-ray, autometry, hydrostatic wave, and total body water. Blood density, hydrostatic wave. However, there are simpler methods of assessing depth of obesity. In furtherance to the issue of autoimmune diseases, a study was carried out to compare some selected informative indices of patients with cancer and age-matched individuals. 10 patients diagnosed with breast and prostate cancer were purposely selected, and apparently individuals the same age, the sex were chosen from the same environment. The weight, circumference, and hip circumference, this circumference were measured. Body mass index, waist to hip ratio, and frame size were calculated. It was concluded from the study that an increase in any of body mass index, waist to hip ratio, and waist circumference, and frame size might be a predisposing factor for prostate cancer. Increase in the waist circumference, an individual measurement. Accurate measurement are non-invasive quality measurement of the body. According to Center of Disease Control and Prevention, metric provide a valuable assessment of nutritional status in children and adults. Accurate measurement can be used to estimate total body fat, nutritional fat distribution. Measurement of relative adiposity and fatness of our body mass index, thickness, weight ratio, measurement. Circumference. Circumference measure the minimum circumference between the iliac crest and the page using the anthropometric tape. This is an indirect measure of visceral adiposity, which is strongly correlated with the disease in adults. In children, circumference of 1 or 2 inches or more in men, or 88 centimeters or more in women, associated with health problems such as type 2 diabetes and blood pressure. Therefore, the value of waste being used among our population may not be ideal enough because they are derived from different populations. A study was designed to establish reference value for the subset of Nigerian population. The cutoff value of waste circumference for the population of our study in Nigeria here is 1.2 centimeter, 7.1 centimeter female, 2025. Neck circumference. Despite the usefulness and relevance of neck circumference in relation to obesity and metabolic abnormalities, its cutoff value used for Nigerian population are derived from foreign population. Researchers have reported that ethnicity is one of the determinants of adipose tissues deposit in terms of size of the body. To 2017, the reference value of neck circumference for women 60 to 80 to 60 years was 37 centimeter, and that of men was 42 centimeter. The implication of this is that the neck circumference of a woman or man 80 to 60 years that is more than 37 or 42 centimeter respectively may predispose such an individual to blood pressure, non-communicable diseases like type 2 diabetes mellitus, or cancer of any kind, freedom from chronic joint pain and non-communicable diseases. Literature is read on the effect of various kinds of regular exercises, the prevention of non-communicable diseases, muscular pain, especially joint pain, that are commonest around our environment. Also, an individual can maintain the body circumferences, especially waist, leg circumference, need the normal range. It will prevent several diseases. The use of a clinical academic. I started my physiotherapy career as a physiotherapist during the National Youth Service Corps service in Cross River State Sport Council, Calabar. Having completed service here, I worked with two private physiotherapy clinics for a period of 11 months. I gained employment with Onia and Son Children's Hospital, Ring Road, Ibadan. From September 1994 to March 1995, I employed which I assumed in April 3rd, 1995. When I got set in Ife, I pursued postgraduate program at the OAU 11. Completed master program, my PhD in physical education. I completed the program in a record time. In the clinic, I enjoy teaching the clinical students comprised physiotherapy, nursing, and medical students, especially when it comes to practical demonstration and skill. This me an award by the Ife University Physiotherapy and Occupational Therapy Association of Nigeria as the outstanding clinician of the year in 2009. I rose to the position of assistant director of physiotherapy services in the period of 15 years. I was appointed as lecturer 2 in the Department of Medical Rehabilitation at the age of completion of my PhD program. I resumed December 1, 2010. That the announcement of become a full professor was made on February 23, 2023, validated to October 1, 2019. During this period of 8 years and 10 months, I served as course coordinator, advisor, chief coordinator for the department, and leader of the department. Successfully supervised close to 100 undergraduate, 6 master students successfully. Observe that my students usually enjoy my classes. First lecturer award in the Faculty of Basic Medical Sciences in the year 2021. I was the chairman of the committee that wrote the curriculum for audiology program, which had been approved by the Council of this university. They believe that the program will soon take off. It's a physiotherapy, this specialized muscular dysfunction. I champion a special interest group called National Association of Orthopedic Therapists. The association is the leading subgroup among the content of physiotherapy practice in Nigeria. The association has been shot to different parts of the country and has produced journal of orthopedic therapy. Remark, sir, give all grace for the guest wisdom, strength, and potential endowment for it of my professional career. To deliver this lecture today, I am most grateful to the government of the Oyo State which I benefited immensely from my primary and secondary education. I also appreciate the federal government for the enabling empowerment and the almost free education for my undergraduate study. I'm very grateful to the of this of Professor Simon Banere, Vice Chancellor, for giving me the environment necessary to grow this level academic. I'm indebted to my lead teachers. physiotherapy. In fact, he was the first professor of physiotherapy in Africa. I have to recognize one of my teachers. So, Ojoawo, he is the one that did academics. It's my mentor to many leaders. To just study for the study of pain, to become a mentor for the study of pain. We have traveled together to different parts of the world. Since speed, serve special. Since the only lecturer today that remain in Nigeria among lecturers that were in the department, I was an undergraduate. Pray that God will be to spare your life, to see more days like this. So my success in this journey, professors, lecturers, non-academic staff, medical education, you are appreciated. Chairman of this inaugural lecture, Dr. Ms. M. Odetinde, and those that participated actively, members of committee, you are highly thanked. My professor and lecturer for my PhD work, you are highly appreciated. I feel a sense of gratitude to Prof. J. Balogun, another lecturer that taught me in my undergraduate days. It is a great pleasure to acknowledge my leaders, Chief Layola Sotole, late of Ibadan, his brother, Chief Adigun Sotole, a source of motivation for me. So Sotole is today seated. I thank you, ma, and I thank Daddy. If it's not today, can be Peter to go. Sotole, the source of anger can must put you appreciate you. Very appreciate you, especially the percent. I mean, depth of leaders of past feminist commissioner, the parliament was seated here. So Dr. Duoke, they are meant for environment. He thanks God to the equipment of Dr. Jidebani Beshi, from his Jidebani for being spiritual father for the ministry. He to appreciate all elders and pastors in the ministry for their support. I'm indebted to my parents, whose unwavering commitment to my education laid the foundation for their current journey that took into today's lecture. I did father said, I will dedicate his life to the pursuit of education children. Thank you, Baba, for the enduring legacy for my mother. Especially about Ojoawo, I use for your excellence, emphasis and sacrificial labor. Why professor, your securing a sound educational foundation remains one of the biggest success to eternal rest. Also honor stepmother, Victoria because Ojoawo. Especially the elder ones, slow, one shape, formative years. Your labor of love is find this reward each of you. I pray people to let Mrs. Adebanjo for their significant contribution to my educational journey. From the material lineage to Mrs. Ajayi, yes. Some mention goes to my immediate elder brother. So Ojoawo and his wife. Stop Mrs. Sheep, spiritual guidance, military person, instrumental my youth. And your impact is first. I'm a message for your of your daughter. Steadfast companionship and nurturing care and his wife, Mrs. Babalaji, and our husband, Mrs. and our my children, adopted. You are the embodiment of social resilience. And integral for this journey deserves special commendation as vital contributor to today's story. this appreciation will be complete. That the appreciation is not right. Mrs. Oluwatoyin was undoubtedly crafted destiny specifically for me. Our unwavering loyalty, dedication, and feeling commitment is a source of strength. She has stood as a president through seasons of challenge and a quiet force to sacrifice personal the advancement of our collective well-being. I enjoy patience and understanding, particularly during the long she remained present, supportive. Yes, we call the spirit of fruit. Journey is a cornerstone in my journey. It is special to our own. Mr. First Chancellor, sir. I render my deepest gratitude to Almighty God. Shape, it's a lecturer in this still institution. To the source of physiotherapy, particularly shall be made of muscular physiotherapy. Transformative education imparted by this great standard of learning. It's our Vice Chancellor, sir. I wonderful dear friend, distinguished ladies and gentlemen, I'm sincerely grateful for your success intention. This question. It says in Isaiah chapter 51, verse 14, in righteousness shall that be established, thou shalt be far from oppression. If you are established in regular exercises, you shall be far from special diseases. Thank you very much. Thank you. No. Yes, I copy.
Certificate presentation. Thank you. Certificate of presentation of inaugural lecture. This satisfies that Adesola Ojoawo, a professor of musculoskeletal physiotherapy and anthropometry in the Department of Medical Rehabilitation, Faculty of Basic Medical Sciences, College of Health Sciences, Prof. University, Nigeria, delivered the 406th inaugural lecture titled Freedom from Chronic Joint Pain and Non-Communicable Diseases, the Odyssey of an Academic Clinician. This day, September 23rd, 2025. Congratulations.
I Unit Committee.